Chief Medical Officer Dr. Roshan Parasram says the highly infectious new strain of the COVID-19 virus is causing the Ministry of Health to re-evaluate its proposals for the reopening of this country's borders. Dr. Parasram was one of the persons who addressed Parliament's Joint Select Committee during their inquiry into the health and safety practices and arrangements at the airports authorities of Trinidad and Tobago in light of the COVID-19 restrictions.
It seems like we're starting over somewhat in the beginning of this new year, looking at the new strain and having significant concerns, much like what we had last year when we saw this thing evolving in China. So our concern is renewed again in 2021, that, we really have to take it one step at a time.
He noted that in July 2020, a subcommittee was formed to look at the reopening of this country's borders. But with the presence of this new virus strain in 38 countries, the reopening date would need to be pushed back.
What has happened with the new strain is that, of course, we have seen a spike in many countries in the UK, Canada, as well as Australia, and across Europe, which really has put a little bit of a damper on the way we were planning to reopen the border. Of course, the decision ultimately lies with the Prime Minister and the Cabinet. But we will make our recommendations based, of course, on the looking at the new strain. What we know so far from the research is that it seems to be more than 50% more infectious in nature. Dr.
Parasram added that in order to keep our own local cases contained, more stringent quarantine measures need to be implemented. Ann Browne-Campbell, TTT News.